Good evening, and thank you for joining our community conversation to examine the impact of COVID-19 and the current significant Omicron surge on MCPS, its students, staff, and families. I'm Chris Cram, the Director of Communications for Montgomery County Public Schools. With us this evening, we are pleased to welcome quite a few guests who can provide critical insight into the many questions and concerns that have been raised by people from throughout Montgomery County. We have county leaders with us tonight, including our county executive. We have a county council member. We have leadership from the Department of Health and Human Services, and we have members of our Board of Education, as well as staff from leadership of Montgomery County Public Schools. We're nearly 2 years into living with COVID-19, and this virus has brought change to everyone in our community. Today, we focus on the county's school system. Leadership has throughout worked vigorously to manage operations such that teaching and learning could continue for our nearly 160,000 students. But it has posed many challenges. Safety, however, has been at the foundation of all of this work. So for our program tonight, we've asked you to submit questions in advance, and we will take questions from the webinar attendees live this evening via the question and answer feature. From the communications we receive daily to MCPS and from those pre-submitted questions, there are clearly overarching themes to your questions. There are questions that are repeated quite often. These will be the foundation of the early part of the program. After we examine those, we will then move to live questions. Although we're here for the next 1.5 hours, time will get away from us. So why don't we go ahead and get started? We're pleased to begin and to have Ms. Brenda Wolf, the president of the county's Board of Education here, to share some opening comments with us. Ms. Wolf?
Thank you, Mr. Cram. Good evening, and thank you for joining us this evening. We are here this evening to have an important conversation with our county partners, our parents, community, and staff. It has become trite to say these are trying times, but that doesn't make it any less true. On behalf of the Board of Education, I want to thank everyone who has worked diligently through adversity to serve our students. As we continue to navigate these turbulent waters, it is imperative that we continue to engage in conversation with each other. Tonight, we will have an opportunity to hear an update on the management of the system during this emergency. We'll hear from our county partners and from our community and staff. I ask everyone this evening to listen, to understand, and share perspectives from a place of collective commitment. I would briefly like to recognize and thank our special guests here this evening, the county executive, Mr. Mark Elrich, county council member, Mr. Craig Rice, and our important health partners from the Department of Health and Human Services, Dr. Raymond Crowell and Dr. James Bridgers, as well as Sean O'Donnell, Public Health and Emergency Preparedness Administrator, and Mark Hodges, who is Acting Senior Administrator with School Health Services. I know your time is very valuable, and we appreciate your being here with us. My Board of Education colleagues are with us this evening too. Let me say thank you to all of them. I think it is important to state up front that all of us on the Board of Education in school system leadership are all committed to providing our students with high quality instruction in a safe space that fosters the well-being of all students and staff. We understand that how we support and serve our students and families now will have an impact on the viability of our community for years to come. So I ask all of you tonight to engage with us, hear the work that is done, ask clarifying questions, share suggestions, and commit to our shared enterprise. I encourage your questions because we have the right people here to answer them. We are committed to greater clarity for our families, and tonight that is part of our efforts to share, hear, and engage. Our community looks forward to having their voices heard, to know and understand that their concerns matter, that their fears are not dismissed. The Board of Education is committed to an open conversation as we navigate this storm together. Again, thank you for joining us.
Thank you, Ms. Wolf. We appreciate your comments. Leading this work, both in her time as Deputy Superintendent, now as Interim Superintendent, is Dr. Monifa McKnight. Dr. McKnight, I believe you're here. Can we turn to you now?
Yes, thank you so much, Chris. And thank you, Ms. Wolf. Good evening to everyone who have taken the time out to join us. I first want to begin by sincerely thanking you for taking your time out of the evening to come together tonight as a community for this very critical conversation that we're going to have about education and schools in Montgomery County. I would also like to acknowledge and thank our elected partners who are with us tonight, whom Ms. Wolf just acknowledged, members of the Board of Education, County Executive Mark Elrick, County Council Member and Education Chair and Culture Committee, Mr. Craig Rice. And again, we are now pleased to have our Montgomery County Health partners, Dr. Raymond Kroll, Dr. James Bridges, and Mr. Mark Hodge, Mr. Sean O'Donnell, all here with us this evening. And for their collaboration, we are appreciative. We are all here tonight to discuss how our school system is navigating the evolving landscape of COVID-19, how we're keeping our students safe, keeping them in school, and keeping their learning at the top of our priority list. So I'll begin by talking a little bit about some of our core values. And as we dive into these important conversations this evening, it is important that we stay grounded in who we are. And I start with that because who we are is embodied in our core values. And in our core values in Montgomery County, we value learning, relationships, respect, excellence, and equity. And we do everything in our power to never waver away from those core values. Let me repeat them again so that we are really clear on the uniting forces that are here to advance this tonight. We focus on learning, relationships, respect, excellence, and equity. We are here to advance them as a Montgomery County community, as families and educators and leaders in our county government. And we can never sacrifice those values as a school system or as a school community. They absolutely undergird our vision to provide the greatest public education to each and every student so that they can thrive and prosper in their futures. And we continue to believe that these values can most readily become alive in our school buildings, where students can be with their friends and peers, and where they can interact face-to-face with their teachers, and where they can explore their passions through extracurricular activities and athletic activities. And I know our families can connect with that because many of our students, they come to school in the morning and they stay throughout the evening because all of those activities matter to them. We understand that the format in which students learn is one of the most important decisions that we make. And as a result, it is a call over which our community, including our students, families, and staff members, harbor very deep convictions. We have appreciated hearing about our attempts to keep schools open and have offered students great opportunities while also presenting challenges that have come with many of the difficulties that we're going to address tonight. I hear and acknowledge and I recognize the concerns, including those from our employee associations who have recently brought that forward. We hope that tonight will help take some of these concerns head on. I do believe that we should run to one problem and collectively fix it together. And we hope tonight that we'll also have an opportunity to reflect on our commitment to a path forward. And as we do so, we must also commit to continuing to move forward together, because this will pass and we will come out on the other end, and we will only get there through doing it together. I'd like to speak about COVID-19 for just a moment. COVID-19 has not, cannot, and will not compromise our values, even as we continue to confront the many challenges of the COVID-19 pandemic. And it's been a long time now. There are two major ways that the pandemic, and in particular, this latest surge resulting from the Omicron variant, has impacted our schools. The first is the variant's impact on our community's health and safety. The Omicron variant's high transmissibility has spread the virus at the highest levels we've seen during this pandemic. And even as we are reaching our county's highest ever levels of the virus, we have more tools than ever at our disposal in place to contribute to schools' health and safety. We have been discussing them since the spring, and we have continued to invest in those measures. We have a mask mandate in schools and are processing and delivering KN95 masks to our staff and students. We have enhanced our air filtration and ventilation systems. We have a robust screening testing program in place to regularly test asymptomatic students. And in response to the latest surge, students and staff will all take home rapid test kits this week. Perhaps most importantly, we are fortunate to live in a county with one of the highest vaccination rates in the United States. And even with all of these measures in place, the rise in the cases is real and is hitting many parts of our community hard. And I want to acknowledge that. COVID has impacted all of us in some way. Some of us have lost friends or family members, and by now, all of us likely have shared the experience of offering support to a friend or a colleague who tested positive for the virus. For me, the pandemic got very personal last week. My family and I tested positive for COVID-19. Yes, I am fortunate that my symptoms have been mild, and I'm able to continue to work while I'm recovering. But just as we band together to support our friends and family who come down with COVID-19, I am calling on our community to unite in support of our school and school system. As we come together to consider the implications of the rising cases for our schools, changing guidance from the state of Maryland also affecting how we made decisions about how we were shifting any schools to virtual learning. Now, while we thought initially it would be appropriate to rely on a threshold to consider whether a school should transition to virtual learning, the state then later clarified that the thresholds should not be used to automatically consider a suspension of in-person learning. That explains why we initially established a 5% threshold for considering transitions to virtual learning before clarifying that any shift to virtual instruction will occur in a case-by-case basis through consultation with the Department of Health and Human Services moving forward. And I acknowledge that and stress that modification was absolutely necessary, and we did that. I offered that in my community message on Sunday, and I want to reiterate it today. Now, we all also know that the impacts of the pandemic extend very well beyond the real health effects. And in particular, consequences in the labor market have impacted our school system operations, our ability to fully staff our schools and transportation fleet. As in other school systems across the country, because this problem is not unique to Montgomery County, current labor shortages resulted in an abnormally high number of vacancies at the start of the school year, despite our hiring around the clock to prepare for the school year. Then, as COVID-19 took hold and an increasing number of staff and substitutes were unable to come to work because they had COVID-19 or someone in their family did, we continue to be impacted. We are making constant adjustments and doing everything that we can to mitigate the impacts of these operational challenges. It's an all hands on deck effort, to be honest, and we're asking buses to maximize the number of runs that they're doing. We're deploying central office staff to schools and asking staff to cover classes on top of their traditional workload. We're continuing to assess multiple measures on a daily basis. And right now, we're assessing all of the following. We're looking at staff absences, unfilled substitute requests, and unserved bus routes in order to determine if a very short-term transition to virtual learning in individual school may best support the instructional program. But I emphasize short-term, and we have to look at that at a school-by-school basis. I'd like to turn the conversation back to Chris Cram, and I look forward to our discussion this evening in which we can get into more details about some of the things that I've shared, but most importantly, to discuss how we will work together moving forward in these areas. Chris, I'll turn it over to you.
Thank you, Dr. McKnight, like a real TV star. Thanks for doing that. Next, I'd like to take a moment to engage with our county leadership who's here with us tonight. Mr. Elrich, to you, sir. The COVID-19 response by our county has been to preserve health and avoid transmission. You put people first in your response. Can you talk a bit about your commitment to help MCPS's efforts in this same goal?
We're all part of the same family, and your work is our work. The truth is that all the money that goes into the county, when we administer it, we're administering it for the good of the county, and the school system's an enormous part of that. And so we're going to consistently be there, and have tried to be there, whether you need testing or whether we need help with vaccinations and or anything else. We want to make sure that we're working in concert with you, and that if there are things we can get you, we'll make an effort to try to get you. And if we have things that we have to talk about, and that's why we've got our health staff here, that you have access to everything that we have access to. This is, I haven't been through this for 2 years now. There is no roadmap. There are no simple answers, and things change on the fly. I mean, I get frustrated, but I watch federal guidance change far too often. And so it's hard for everybody to always be doing the latest thing when the latest thing changes. And COVID is a wrinkle that nobody really thought about. I was going through some communications the other day, and I found something from the end of November, and it was like, new variant, what does this mean? And they had no idea what the new variant meant, and they had never seen anything like this variant. And I think assumptions about spread just kind of went out the window. Assumptions about levels of immunity. I think, what I think you can say safely is true, that if you're vaccinated and boosted, you're not likely to get serious sick. But it's no longer that, if you're vaccinated, you're very, very unlikely to get it. Actually, it appears that you can get it far more often than you thought. I'm vaccinated and boosted. I'm in a house with people who are vaccinated and boosted. All three of us got COVID. And I'm in day 12. So for people to say 5 days and you're fine, just go about your business, I'm 12 days and I'm not fine. And I'm testing positive. So I look at this, probably from a personal perspective of being aware that, I think people have been, and I'm not referring to you, I think at more at a political level, at a national level, too anxious to declare victory and too often wanting to say this is over with. And the fact is, we're not anywhere near declaring victory. This is not over with yet. And we've got to focus on, what we did that kept us safe. I think about, where Montgomery County was a year ago. The reason our numbers aren't the numbers we have today, or weren't the numbers we have today, is because everything was closed. You couldn't go anywhere. There are a whole bunch of things you couldn't do. So we had tackled what we know about COVID, which is this is a person-to-person illness. It doesn't transmit through the ductwork. It's not, it's obviously not totally sensitive to touch. So it's really, how close do you get to other human beings? And we've kind of moved away from policies that kept us farther away from human beings and kept us safer. And I think, we're looking at this not just in the county, but in the country at large at, very high case rates, very high spread, and more people in hospitals. And I think I'd say at this point, the things that concern me most are the folks in the hospitals, the overload on the medical system. And when I talk to people, and I've talked to some of the hospital directors about this, that anything we can do to slow the spread is beneficial. Getting hit by a big wave in the hospitals is going to really jeopardize them. We think we can all see how little room is left in the hospital. Craig, you've got personal experience in this now. So to the extent that anything we do slows down the spread, I think actually deals with, the threat, helps deal with the threats to our health system. So I'm here to listen. I'm concerned, and I'm the same person I've been for the last 2 years. My tendency is to want to err on the side of caution, because caution will keep more people healthy. So that's my perspective on this.
Thank you, County Executive. We very much appreciate you being here and being able to be a part of this conversation. Mr. Rice, if we could turn to you now. Thank you for being here with us tonight. The council sitting as the Board of Health has had to make some significant decisions as well regarding masking and numbers of people that can gather. Do you have any thoughts that you'd like to share with us tonight, especially as it relates to schools?
Absolutely. Well, thank you very much for having me. And first, let me say that I really want to appreciate all of the parents who I'm one of, It's one in which those same concerns that each and every one of you have, I certainly understand. And I really want to thank our staff and our teachers and administrators who are in our schools each and every day, who continue to put themselves at risk. And we understand that's what happens for everybody who goes to work and works on the front lines. And each and every one of you are that. And you're committed. Being the son of a teacher and principal and then university administrator, my mother, who County Executive Elridge was just mentioning, unfortunately was hospitalized this weekend, that scared me to death, was actually one in which was dedicated to serving her kids. And I know what each and every one of you do each and every day in serving our children. And I want to say thank you for that. And so we owe it to you, just as we owe it to our kids, to try and get it right. And that's hard. It is very hard to figure out a way in which we can ensure the safety of everyone and their families, and also at the same time ensure that we can do the best by presenting our students in front of our teachers, which we know is the best scenario for the best outcomes for our kids. But we also have to make sure that we're doing our part when it comes to protecting people as well. And so we stand ready as the County Council to ensure that we support our Board of Education and our Superintendent of Schools. We have tried to do that when it comes to the resources around PPE, when it comes to the KN95 masks, when it comes to staff and personnel. Part of the challenge is beyond our control, beyond the Board of Education's control, beyond the superintendent's control. When people get sick, like my daughter's teacher, for an American Sign Language class and can't be there, there's a challenge in trying to replace that person. That's a very nuanced person. As a person whose mother taught at Model Secondary School for the Deaf and then was principal and university administrator with Gallaudet University, I understand that that's a very unique skill set. And it's hard to find. And so to try and find a substitute for that class is difficult. And then so parents say, well, what is my child learning while they're in that classroom? During the midst of COVID and during all of the challenges that we face and trying to just make sure that every single teacher slot is filled. I get it. I understand your concerns, your frustrations, but do understand that this is something that, again, is well beyond something that we have the silver bullet to. When we look to our neighbors in Prince George's County and what they just announced, keep in mind, they're not back in school yet. So for those who are adamant about folks staying in school, they're not in school. And for those who are adamant about schools being closed, they're going back to school on the 18th. So it is one in which, again, we see ourselves continuously challenged, but we commit to trying to do everything we can to support our system. And so that means that the County Council stands ready to allocate additional funds wherever needed and necessary. And I really want to say that the message that we have is that we stand with our school system, we stand with our teachers, we stand with our students and their families, all together to make sure that we can do everything we can to keep our kids in school, but to do so safely. That is incredibly important. And so I also wanted to pass along a message from our council president, who unfortunately couldn't be here this evening because he was booked for another event with our People for Disabilities, and he was their keynote speaker there, that he's also pledged his continual support. You heard it from the press conference today, and understands that the County Council stands ready with Council President Albornoz, Council Vice President Glass, and all of us on the council to make sure we can do everything we can to support MCPS, support our students, support our families, and support the staff and administrators and the people in our school buildings. So back to you, Chris.
Thank you, Mr. Rice. We appreciate your comments, and you set us up well for our next section. We're getting now to the overarching questions that I mentioned before. As I stated earlier, the pre-submitted questions identified a number of overarching themes or similar questions that were asked many times. We're going to get to those now, and I'll call on our panel to address those. To our panelists, if you have a point to add as we go through these, please speak up. Again, our goal is to allow time necessary to be thorough in our answers, but I'll also be watching the clock so that we can get to the live questions later in our session this evening. The first question, and we're going to start, I believe, with Dr. Bridgers. There was a shift in guidance that we experienced last week in potentially moving any individual school into a virtual learning. Can you talk about how that came about and why there was a change?
Sure. Thank you, Chris. Great question. First of all, thank you for inviting me to this very important conversation this evening. Thanks to Dr. McKnight and her team and Dr. Wolf and all of the members of the Board of Education, to Mr. Elridge, to Councilmember Rice, and to Dr. Kroll and all the members. Some are assembled this evening from our team to help respond to the questions. So the shift wasn't an absolute shift. As Dr. McKnight indicated, we have many tools that we are deploying now to keep our students in school. Simply that. There's no one best fit scenario. We look at many metrics to identify thresholds and identify those percentages. We work with the Maryland Department of Health, their epidemiologists. We work with our epidemiologists. We work with our communicable disease team to determine those metrics that will support in-school learning. We have a preventative plan in place, and we follow guidelines by the CDC, by the American Medical Association, by the American Academy of Pediatrics. And so we look at those thresholds to determine the best fit to keep kids in school, to keep our students in school, and to look at those individuals where we need to identify more preventative measures, more protective measures. And so we did that shift. We had many conversations over the past month about how those metrics will apply to not only the school setting, but the impact that this Omicron variant, this highly transmissible variant, this highly contagious variant is impacting the community. So that's just a quick summary of some of the measures that we continue to examine and put in place. I want to be very clear that that 5% threshold was not an absolute threshold.
Thank you, Dr. Bridgers. I think, Dr. McKnight, can we come to you as well on this question? Do you have any thoughts that you can offer on the shift that we experienced last week?
Absolutely. I wanted to acknowledge the second part of your question, Chris, which was about the shared decision-making process and how do we come to that. And I think it's really important to acknowledge that we as educators, we've been doing what we've been doing for a long time. We educate children, we support families, we make all of those decisions around teaching and learning. And so in the space of really thinking about how we manage a pandemic, the collaboration with our partners have been key in this process. And I must say, it has been a collaborative effort that's been one that the school system has depended on greatly. And so when we think about what that collaboration looks like, here's what it looks like. Since the beginning of the pandemic, meeting minimally once a week, trying to predict what would possibly come when, quite frankly, with this unprecedented nature of COVID-19, it's a moving target. Something changes every day. But we meet every week, minimally, sometimes twice a week. And when we have a new guidance that comes out from the CDC that then has to be translated by the state, that then has to be translated locally, we have to talk about how all of those steps are either clear or not clear and work with the information that we do have, combining the expertise of health combined with the expertise of education and trying to come together to make the best decision. And so that's what that collaboration looks like. It happens often, very frequently, and we bring our expertise and our input from the entire organization. The reason we started to meet every single week minimally when we started to work through the pandemic was because we recognized that we needed to be able to collect information and input from so many other stakeholders who were experiencing this on the ground. Those who were in our schools, those who were in central offices, and all of those spaces around our school system. And so we have engaged them in that conversation so that when we meet as a school system with DHHS, we're bringing the most informed, updated information so that we can try and make the best decisions with the information that we have. And in some cases, we have to work with guidance that's clear. And in some places, when it's not and it's very gray, then we have to make that determination. But what we're committed to doing, which is exactly what we did last week, was when we made the best decision that we could with the guidance that was available, when we learned from the state that that's not what was expected, we corrected it, and we corrected it immediately. And so that's the type of collaboration that we look forward to continuing to engage in and being transparent about our work together, and depending on many others to feed information into us so that we can have that available when we make those decisions.
Thank you, Dr. McKnight. And don't go on mute just yet, because I think this next question, we're going to come to you too. It's an important one. We've heard this many times. You know, we have said as a school system, you certainly have said many, many times that MCPS is committed to in-person learning. And so why not just default to virtual learning for the period of the surge? Can you talk about that commitment that we make?
Absolutely. So we knew when we were in the pandemic, starting in March 2020, and we had to shift in 2 weeks and go to virtual learning. We were proud of the fact that we were able to do that as a school system. We did it quickly, we did it swiftly, and a lot of people came and worked a lot of hours from morning to night over many days to figure out what do we need to do to serve our students. And that's when we became those frontline workers. And as I think about that, we went into virtual learning, not knowing what to expect, not even knowing how long we would be in that circumstance. But as one month went on, 2 months went, a graduation happened, summer happened, we were still virtual. We were preparing to open for the next year. We still were virtual. That's when we recognized this is a long-term game that we're working with. And we knew at that point that this was for a much longer period of time. And we know that as educators, our students really thrive off of interacting with us, looking us in the eyes, building relationships with us, figuring out how we're able to help work through challenges with them, learning challenges, or even celebrating successes with them. All of those things that just require that we are together and that we're building off of relationship and trust and all of those personal pieces that are part of just the DNA of what education is. And so knowing that that's been a part of the DNA of our very core of this profession, not having that for a long period of time, we recognized when we were on virtual for much longer than we planned, there were going to be some consequences to that. And our early learners and many others showed us that when we started to pull our data and assess our students when we returned to school this fall. So yes, our data has shared with us, particularly our early learners and those who are impacted by farms and other areas, that in-person learning is absolutely the best opportunity for those students to engage. And let's not mention some of the gaps that existed within those very groups prior to the pandemic. And so that's why that commitment stands, and it stands firm. With that said, I started out sharing one of our core values is that we protect the integrity of education. So it also has to be an experience of quality. And so that's why I mentioned earlier, we have to continue to have the conversations around what are the real stressors that really do impact our infrastructure, that really do get in the way of operating that and could very well compromise the value that we speak of, which is education. And the tenet of how it really is built to interact with students. When that's compromised, then we have to address what those things are and face the reality of, okay, we do have a virtual learning platform. We've learned some things from it. We know how to engage well in it and decide when it is appropriate in real circumstances.
Thank you, Dr. McKnight. We also have Ms. Rochelle Rubin with us tonight, Chief of Teaching Learning in Schools. Ms. Rubin, can you speak to the same question? Why is it important to make this commitment to in-person learning? You and your staff see what's going on in schools every day. How are the kids doing?
So good evening. Thank you so much. And thank you to all of the parents, students, the administrators, the teachers, everyone that is working so diligently to help to support around a challenging issue in time. We know that the in-person learning, there really is no replacement for that live teacher instruction. We also know that as a result of the continuing human health crisis, we displayed our data in September that illustrated the deep and impacting learning loss that many of our students, especially our youngest learners, suffered as a result of being out of school for more than 18 months. And so in the last few months, being able to have our schools open 5 days a week, we have been able to work on the plan for mitigating the learning loss through the instructional process, that literacy, that math at that elementary level, and certainly all of our courses at the secondary level. We've also been able to receive our students back for that relational piece, that social emotional piece, the opportunity for our students to interact with their teachers, with each other, to really get back a sense of normalcy that was missed. All of those things combined make it extremely important for that. And we've seen our teachers and our adults be pleased to be back in that circumstance. And certainly we understand that that work is really at the heart and the center of what we do as educators. The times are challenging, and what we're talking about is, as we work to mitigate that learning loss, to make sure that our students are well, how do we do that in the safest and best way possible? And that is the work that we've continued to be focused on.
Thank you, Ms. Rubin. Let's turn to the issue of safety a little bit from a health perspective. What measures are in place contributing to school safety? Steps that we've taken to promote safety in our schools, and what helps us to determine all that? If we could start with our health professionals first, Dr. Kroll or Dr. Bridgers, would either one of you like to start with a comment there?
Sure, be happy to, Chris. Thank you. And first of all, let me say thank you to Dr. McKnight and to the team for putting this on and inviting us to come and join with you all tonight. And also, I want to say thanks to the teachers and to the parents and to the families who are out here listening, who are dedicated to trying to keep children in school and trying to keep children safe at the same time. Our work to keep in the county with Health and Human Services and the county executive and MCPS has been to keep us all safe, both in schools and in the community throughout this pandemic. And that has been a full-time, steady challenge on a regular basis on a daily basis now for many months. And Dr. McKnight noted that we meet weekly with the school, with MCPS. We actually meet daily. There is someone somewhere in touching base between Montgomery County schools and Health and Human Services on a daily basis to track what is going on in the schools. How do we manage to solve some of the problems that arise as they arise? So that has been an ongoing process, and we don't expect that to stop. In terms of safety, we're vaccinating at the pediatric level and inviting families, and I want to thank the families that have come to get their children, have brought their children to be vaccinated. So we're doing that in partnership with the school and across the county. We are encouraging our older students and our adults to get boosters. Those are still the most important things that any of us can do in the county to protect the safety of each of us and our children. Our school health staff is in the schools daily, and they do symptomatic testing and work with students who show up who may be ill and do testing of them. And we've encouraged and worked with the schools in their effort to say yes to the test, to get more students and more parents to say yes to letting their children be tested and be screened for testing, so that can help us to track and contain this virus. There's a lot of, I will go do a little bit more of this, and then I'll stop for just a second. But one of the things that has happened here is that as the school opened up, we realized that we had to expand our testing capacity. So we brought in additional teams to do testing in the schools on a regular basis. Testing is how we track and trap this virus. It is how we know where it's going and where it's spreading and how we work to contain it. We are trying to balance between addressing a virus that will not let us go and continues to plague us and the health and protecting the health of students with the health with the mental and emotional health of students by keeping them in school and dealing with helping them to grow and develop in as traditional a way as possible, in as safe a way as possible. So I'll stop there. There are more things I would talk about that we are doing in the schools and across the system, but I will pause and see if Dr. Bridgers wants to jump in with some things.
Sure. Thank you, Dr. Kroll. Some of the other preventative measures that we're using to keep the Montgomery County public school system safe and its families and its students is that we continuously look at surveillance data. We use other models such as New York City school system, Los Angeles, San Francisco, Chicago, to look at those better practices for us to deploy. So we look at absenteeism, we look at severity of illness, we look at student to teacher ratio, we look at in-school transmission versus community transmission. We look at age of those individuals who may have breakthrough cases, be it from 0 to 9 or 10 to 19, especially for those who are vaccinated. We know that our community level transmission is very high. That means that you're more likely to contract the virus than not. At any point over these past 22 months, we had 2,400 cases today. We're testing in higher volumes. We thank our Montgomery County public school partners for serving as venues to test our students. We know that testing is key to identifying and mitigating and suppressing the spread. We're also looking at pediatric cases and the impact that COVID has on students. And lastly, we're looking at reinfection rates. We know that this Omicron variant is very enigmatic, is very tricky, and we're assessing and surveilling all of those data points. So that's one key measure that we are continuously, daily, almost 24 hours, 7 days a week, looking at those metrics to keep folks safe.
So one other thing I would add, thank you, Dr. Bridges. One other thing I would add to that is a thing that we have done within the last week, and starting last week and this week, and that is we worked with the administration, the school administration, to make available 190,000 rapid tests that for every child in the school system, and every student in the school system, and every staff member, to be able to take home to help us to understand where this virus is and to help people to identify themselves and their students and their family members to determine if they're positive or not, as a means of keeping people safely in school and helping them to stay safe, helping families to stay safe. This is something that families can do and parents can do to participate and to help us in this process. This is something we cannot do alone at this point. Making sure that our children are safe is a joint responsibility. We know you take it seriously, we take it seriously as well. This testing is a start of a process that will help us to do that.
Thank you, Dr. Crowell. Thank you, Dr. Bridges. Dr. Crowell, you touched on one of our later questions. Both of you did about testing, so thank you for doing that. Before we leave this issue of safety, though, it makes me think, and I want to turn to Ms. Dawson. And I'd also like to go back to Ms. Rubin. Jeannie, can you talk about the materials that we have in our school to help ensure that there's a safe environment? And then Ms. Rubin, if we could turn to you or even Mr. O'Donnell, who I know is here with us from HHS, about our efforts to bring vaccination to our students throughout the county. So Jeannie, can we go to you first?
Absolutely. And good evening, everyone. We are happy to be here to answer all of these questions. One of the things that I want to make sure that we're really clear about is when we procure materials, we use quality assurance measures in order to do that. And that's for all materials in the district. So we use standardization with limitations around federal, state, local guidelines, specifications, inspection and testing. And the Department of Materials Management, who runs our warehouse and all of the supplies and materials, everything from pencils to textbooks to tests in the district, works in conjunction with procurement to procure essential PPE for all schools and offices. And we do this through a centralized approach. Our PPE inventory is sent quarterly to all schools and offices with ongoing replenishments on a regular basis. And we also provide PPE in particular that is approved according to our material safety data management sheets and are compliant with all health guidelines. We have a safety officer that we work with that inspects and assures those guidelines are met. Just to make clear, we have delivered everything from gloves to masks to hand sanitizer to Santa wipes, face shields, goggles, gowns, everything. And we also work in particular with providing staffing numbers and enrollment numbers for each school, and then central office personnel. When we talk about the masks and updates, we have the KN95 masks. All middle school and high schools have received a pack of 10 of KN95 masks for each student. This should move us through January. We have more coming in. The small sized KN95 masks, they've arrived at the warehouse yesterday. By Friday, 50% of all elementary schools will receive those KN95 mask shipments. And that's going to include, when we talk about the small size, we're talking pre-K through grade 3 recommended fit. And then the standard size for grades 4 and 5, they're recommended. The remaining elementary schools will receive the mask shipments at the end of the week or the beginning of next week. And you know, the delay on some of that has been weather and getting the trucks in, but we now have that in. The other thing I wanted to highlight on the KN95 masks for our distribution, they're evaluated as face coverings and masks and not as respirators. They're face coverings, and they function as that source by reducing the release of respiratory emissions from the wearer in that environment. So that face covering provides protection for the wearer. The masks included in these shipments meet those standards. MCPS is not providing counterfeit KN95 masks. We do evaluate those and we review those for their information on the vendor and manufacturing information. The other thing that I wanted to mention was the iHealth rapid test kits. We are so grateful to DHHS for providing that 190,000 for us, and we have provided those for all students and staff. They did come to a box, and we are again grateful to receive those. We know that we're working with DHHS to get our next shipments, and we will continue that partnership, like Dr. Call and Dr. Bridges has said, which is weekly and daily. Thank you.
Thank you, Ms. Dawson. Before we move to that vaccination part, which I mentioned, since you talked about masks, Dr. Bridges, didn't you say that Mr. Hodges can talk to us about what is correct about those KN95 masks, how a mask is meant to fit and should be used?
Yes, Mr. Hodges and Mr. O'Donnell, we had a conversation about this earlier. So either one of them can speak to the efficacy of correctly and consistently wearing a mask.
So either one of you gentlemen want to take that up?
I will do it since Sean didn't jump in first. So yeah, everything that we're hearing now is that any mask is better than nothing at all, but that the KN95 mask, because it's triple ply and has a thicker weave, is much better than either a surgical mask or a cloth mask. And so that's the reason why the CDC and others are really strongly encouraging the use of this, and why MCPS and the county generally are offering to provide the KN95 masks to students and teachers. So they are a little thicker than what you would normally see in a surgical mask, a disposable surgical mask or cloth mask. They often just have ear loops and are easily worn. They also should have a metal clip at the top for the bridge of the nose, so you can secure that tightly there. Wearing it just loosely around your nose and mouth does not offer the protection that you need for the correct use of this mask. So you want to be able to put it on so it fits tightly over your mouth and nose, and you can use that clip over the top. If it does not fit tightly, it is not doing its job. And so to have the right size, to have it fit correctly is going to be very important. The only mask that we know that is better than KN95 at preventing the spread of COVID is the N95 masks. Those are what are used in hospitals and in healthcare facilities because they have to be fitted. There are different sizes of those, and without fit testing, they won't fit properly and don't work properly. So that's why use of the KN95 masks are the best alternative to those that are used, masks and respirators that are used in the hospitals.
Thank you, Mr. Hodges. I appreciate that. And if we could turn to the vaccination discussion now, I know Mr. O'Donnell and Ms. Rubin, staff in your office have been very vigorous in getting vaccination opportunities to our students across the county. Can you talk about those efforts and how they're continuing?
So I can jump right in, and then Mr. O'Donnell, who has been such a staunch and wonderful partner with the school system. in getting out the message about the importance of vaccination. I think currently MCPS has one of the highest student as well as adult vaccinations in the nation. We have worked especially hard with our school partners. Just like to thank the school principals, the families who've really come out to support those vaccination clinics. Even the booster efforts that are well underway now have really been significant in helping us to really change the tide of the ongoing infectious process in our particular district. And that model has served us well. So Mr. O'Donnell, love for you to jump in.
Sure. Thank you. And it has truly been a partnership between MCPS and HHS in this vaccination effort. And the third member of the partnership are the families who have brought their children out to be vaccinated. We've been doing this now for more than a year in the vaccination game. And some of the earliest folks who were brought in to be vaccinated were our teachers and other staff at schools, knowing that they were looking to return back to a setting that could put them at increased risk. As we moved on and had different eligible age groups, we worked when the 12 to 15-year-olds became eligible over the summer, we began working with MCPS on offering clinics at the schools and doing communications through MCPS. And it returned very, very significant number of families coming out who we had not seen come out to our other sites. So in preparation for the 5 to 11-year-olds, we started working right away with MCPS, identifying mechanisms on how to get vaccine out quickly to meet the demand, as well as out to every corner of our county so that families wouldn't be overlooked in the process of getting vaccinations, whether there were challenges with transportation or the times that the families may work in order to bring their kids in. So we've worked on that, and we have achieved significantly high levels of vaccination, but we continue to offer these clinics, and we continue to try to move the needle on not only getting our 5 to 11-year-olds vaccinated at rates similar to the other age groups, but also bringing back the older children. And we all know now that the 12 and above are eligible for boosters after 5 months, which is a majority of our 12 to 15-year-olds. Beginning this past weekend, we began offering at our county-run clinics that were for 5 to 11-year-olds, we began also offering boosters for those older family members, siblings, or parents. Additionally, you can get a first or second dose there if you have not yet gotten it. We also look at the epidemiological data that we gather on where vaccinations are occurring. And this past week, we looked at the data and we saw that we had lower vaccination rates on our East-only area of the county. And so we worked with MCPS to identify a school in that area that we could have vaccinations, and particularly to do outreach through the school systems, as well as through our community partnerships who do door knocking and other promotions. We're deeply committed to getting vaccine to everybody throughout the county, because that is the best line of defense. And for those that were vaccinated more than 5 months ago for Pfizer, more than 6 months ago for Moderna, or 2 months ago for Johnson & Johnson, we strongly encourage you to come out for a booster. We're seeing that those individuals who have been boosted make up a very, very small number of the individuals who end up in the hospital from COVID. And that is one of the most important driving bits of information about getting vaccinated.
Thank you, Mr. O'Donnell. Appreciate that very much. The last overarching question, one that was repeated frequently in your pre-submitted questions, was about communications and clarity. And I would like to take a moment to talk about how our audiences can stay connected with MCPS, but I also know that this is something close to Dr. McKnight's heart, and she made a commitment to doing more of that in the coming weeks. Dr. McKnight, did you want to talk about communications a little bit before I make my comments?
Sure, Chris, thank you. Tonight, I think, represents one of the perfect examples of why communication is important. When we face a crisis, we have to talk a lot, we have to talk often, we have to spend time to explain and ask questions and get answers to those questions. And so throughout COVID-19, we have continued to recognize frequent, accurate, clear communication is important. And not only that, how are we communicating with all of our audiences to share information that they need? Even our students, I mean, they are the recipients of the educational structure that we have set up. They are recipients of the education support and programs that we provide every single day. How is important information getting to them? And how does their voice elevate in this discussion? And so continuing to engage in that is important. Tonight, like I'm going to be involved in an Instagram live session with our student member of the board, Ms. O'Looney, to be able to talk with our students about processing all of the information that was shared tonight and what it means for them. So we have to continue to do that. And as we break down communication, being clear about the audience and what the audience wants to know is really important. Another valuable lesson that we've learned in different ways throughout managing COVID-19. For instance, I think about our staff often, and I do communicate with our staff very often, and we send out emails. And we can't do this work without our staff. We can't, nor should we, because they're experts in what they do. And so how we communicate with them, solicit information from them, and how all that has to be taken into consideration to then share with our community what our plan is exactly how we have to do it. And so as I think about communication, I do want to make a few commitments to our staff and to our community and to our students is that we will continue to communicate often. If we need to come back on and have community conversations more often, to share information that's important or to clarify questions that our stakeholders may have, then we'll do that. And so I just ask that we continue to have that two-way communication, and most importantly, communicate in a way in which we are working on solving these problems and modeling for our students how to do that, because they're going to one day be sitting in the seats that we're all sitting in and being responsible for the very things that we're responsible for. Hopefully not having to manage a pandemic, but if that's if it is, we want them to be prepared for it and share as really good models of how you work through these challenges. And most importantly, how do you communicate with one another to solve those problems for the benefit of everyone? So I restate our commitment to doing that for our entire community. That means all of our families, and really communicating in the various ways that really makes the connection to each of our families, and acknowledging that that's very different, and we have to take many considerations into play in terms of how we do that, and getting the information out, not expecting everyone to come to us to get it. So those are the pieces that I absolutely would like to share about our commitment from the part of MCPS and what we're going to do and continue to do in the future.
Thank you, and I couldn't agree more. Certainly from my seat, communication is very important, and we do that in a variety of ways. Dr. McKnight stated the importance of it. Let me just talk a little bit about making sure that you stay connected with the MCPS. Parents and families, make sure that we have your most up-to-date information so that we can reach you with our emails and our texts. Those of you in the county, make sure you sign up for Alert Montgomery, which for us is Alert MCPS. We do things in multiple languages. We meet with cross-functional groups who help us with our messaging, help us to understand what's important and how to make things simple and declarative. We do things, as I said, in our social media channels. We do things with video because we know that people remember the things that they see more so than the things that they may read. And we do communicate frequently. I would encourage you, please, when we send something to you, we've put a lot of effort into making sure that the right information is there and that it's easy to understand. Now in COVID-19 and some of the guidance we've given, it's very nuanced. And so sometimes it's hard to explain, and we're working to make that as simple as possible. So please read what we send to you, look for it on our website, use search on our website. We put a lot of effort into making sure it turns up the right results. And there's much more that we do. And I just want to say thank you to the staff that works in this office that communicates with staff, MCPS employees, that does things in other languages, that creates the television programs, and of course, takes care of our social media channels. So with that, let me move on. We're right at the point now where we can start taking some of our live questions. And Dr. Bridgers and Carl, I'm going to come to you right away with this first one. This is one we got in our chat this evening. It's a live question from Errol. are you considering, or what would be the process? He writes, are you considering mandating vaccinations for all students? I imagine that's not your job to make happen, but how does that become a reality if it needs to be?
So thank you, Earl. I'll start and Dr. Kroll can add. Great question. We would work with Dr. McKnight and her team and make recommendations to the Board of Education if necessary, similar to our communications with our county council, sitting as the Board of Health. They then would review those considerations and offer feedback, ask for additional data, and have an open forum for the MCPS community, I suspect. And then we would provide any follow-up information as needed as far as whether or not a vaccine is mandated or the efficacy or what the data and science is saying about that based on, again, the number of individuals who are unvaccinated. But Montgomery County Public School has been very, very responsive to our requests. Every time we've had vaccines to be approved by the Centers for Disease Control and Prevention, Advisory Committee on Immunization Protocol Practices, ACIP, they have been very receptive. We would get authorization on one day, and our MCPS community and parents. So thank you for being responsive. Getting vaccinated is the very first tool in CDC's prevention toolkit. And so every time, and so if there was a need for a mandate, we would provide the recommendations to Dr. McKnight and her team.
So the only thing I would add to that is is to remind the community that our vaccination rates in Montgomery County are amongst the best in the nation, not to mention the state. And that is a direct reflection of parents and family members and individuals coming out to get vaccinated and to get boosted and now to get boosted. And we are in the midst of asking family members to come out and have their children vaccinated and have those and get those boosters. It's not everybody, but it is a great, the response has been overwhelming, and there is no reason for us at this point to say that we've lost faith in the community and the family members and the households that are sending students to school and their ability and willingness to get vaccinated. We can bring it. We're bringing it as close to you and into schools and into the communities, and as we have done for the last 20 months, and we'll continue to do that. We need the community to continue to do what it has been doing for the last 2 years, and that is to take up the call to get vaccinated and to get boosted. It is certainly the safest course of action for all of us at this point.
Thank you to both of you. One of the other questions that has come in, let me see who sent that. And this will go to, at least at first, Ms. Helen Nixon, who is Chief over our Human Resources and Development. Oh, this is from Sarah. She asks, what is it that we can do or you are trying to do to address our staffing shortages? And I presume she means both in terms of COVID-19 problems as well as in general staffing shortages.
So thank you and good evening to everyone. Thank you for the question. We have a very active recruitment team in the Department of Certification and Staffing. We have a live website. We have a call for substitutes. We have job fairs every 2 weeks recruiting substitute teachers. We have vacancies that we continue to work very diligently to fill. So we ask community, we ask faith-based organizations, we ask our advocacy groups, we ask people to help us promote MCPS as a great place to work. We have, as I said, our Department of Certification and Staffing and our recruiters have live events. We had right when we got back from the winter break job fair, and we had over 300 people who came to our job fair just before the winter break. And we know that there are community members and citizens who are looking for employment, and we are a great place to work. And so we encourage people to visit our website. We encourage people to register for our job fairs. And we have worked very diligently with Mr. O'Donnell last year to get our staff members vaccinated. And we just today, we put out a communication. We have many sites in Montgomery County at our elementary schools and our high schools. We put out a communication that is promoting the MCPS sites that have vaccinations and boosters being offered and testing. So we are doing all that we can to make sure that employees who are coming in have, as Ms. Dawson said, the PPE that they need to be in our schools. And we, as I said, are actively recruiting. So please visit our MCPS Careers website and please consider us as an employer if you are looking for a job.
Thank you, Ms. Nixon. I'd like to turn now to this question. This one will go first to Dr. Dawson and then to you, Dr. Bridgers. I think, Dr. Bridgers, earlier in the program, you talked about the importance of testing. This first question is Catherine with a C, and I say that because the second one is from Catherine with a K. But Catherine with a C says, how often will students and staff receive take-home rapid tests? Is there a plan to send home these tests on a regular basis?
So thank you, Catherine, for that question. We're working with MCPS now to prepare a distribution plan. I know Mr. O'Donnell actually sent one over to me and Dr. Kroll and our team based on his conversation with our MCPS partners. The county has worked very aggressively to secure take-home kits, rapid test kits, and we're setting up information portals. We're setting up instructions in multiple languages for our community. And so that's to be determined exactly as far as that plan is concerned, but we're working on a plan to get more test kits out. We know that testing is a key. It is a very preventative measure that we have been exploring and using, and now is coming into practice. So, Mr. O'Donnell, if you want to add anything else to the plan, identify, enhance any of the information as far as the details of the plan, please feel free to do so.
Well, I just wanted to acknowledge that we understand, we operate the PCR testing clinics of the county. We've been working to acquire rapid tests since early fall. And we understand the frustrations with having enough testing, particularly as Omicron has come across and created a demand that is extremely high. And so we are working very hard to bring more in. We know that what we have on hand now is not sufficient for everybody in the county to test as frequently as they want, but we placed another order for another 1 million tests to come in. We are working with not only MCPS to provide tests, but our private school and our daycare partners as well, who have similar issues with trying to keep open and trying to identify positives and keep their other children and their other staff safe. And we have a lot of also at-risk populations. So we are sending more rapid test kits to the schools this week. I don't know if they went out yet this morning, but we asked them to send additional supplies to the schools, and we're working with the schools. We know they're also working on procuring additional tests. So we're approaching this in as many avenues as we can to ensure that we can get the testing that we need for families to feel safe about their status, to know when individuals who are symptomatic, if that is COVID or not, and if they've been exposed, if that is COVID or not. So we've been doing this with our school health rooms. I know my colleagues in school health services have been working incredibly hard, in addition to what they normally provide to the schools, to do the testing of symptomatic kids. And we brought on additional staff and contractors to help us increase that amount. So I appreciate that there's multiple different ways that testing is occurring in the school, and with the distribution of these kits, both through MCPS, through the libraries, through as many different mechanisms as we can. We're trying to get these in the hands of our populations so that they can, again, protect themselves and know their status.
Thank you, Sean. Dr. Dawson, did you want to talk at all about, how we're ready to distribute, and that, we have a really substantive system by which we can get our materials to schools?
Yes, so thank you for that question. And we certainly thank our DHH partners. Again, I'd like to just highlight the fact that we're doing multiple measures in terms of testing. We're using the COVID rapid and random testing approach. And we're partnering again with DHHS, but we're administering the rapid testing in all our schools, as Mr. O'Donnell talked about. And we're doing that in two ways. So the rapid testing is through the health room and through the health nurses and techs there. And we're also providing random testing for asymptomatic students by Scion Diagnostics. And that's really coming from our screening program through our partnership with the state and that vendor. What's good about, really terrific about that, is we are in all 209 schools, and it is using that random testing in an effort to really minimize, again, student quarantines, and it is a PCR test. So it does, provide good information for our families, and that is happening every week in our schools. And that is consistent. The other part of enhancing testing is the 190,000 test kits that we got. And again, as I said earlier, those test kits have been delivered to all schools. If a location requested additional test kits, we are, because of any kind of enrollment change, we are out there. When a request is made, the warehouse will provide it with the same day or next day services. We are not Amazon easy, but we really try to be very efficient and effective in providing those distributions for staff and students to take home.
Thank you, Dr. Dawson. I know that our MCPS Chief of Staff is with us this evening, Jimmy DeAndrea. Mr. DeAndrea, did you want to talk about testing?
Thank you very much, Chris. I just wanted to add on to what Dr. Dawson said. Thank you for giving an overview of our testing program and the different components of that. But to follow up on what Dr. Dawson said, I just wanted to reiterate that we're very grateful to DHHS and our county government for providing a rapid test kit for every single one of our students and staff members. Those are being delivered this week. If a student or staff member in a school-based site did not get one of those tests, they should consult with the school administration to be able to receive one of those test kits. And then we're asking that all students and staff members administer those tests at home prior to the end of this week. And then at the top of our website in the COVID information box, there's a link where we're asking all students and staff members to submit their results, whether positive or negative, so that we have as complete information as possible about these tests. And once again, this is one of our key mitigation measures as we work to do everything possible to help in keeping schools safe. Thank you, Chris.
Thank you, Jimmy. Before we leave this issue of testing, I want to get back to what Catherine with a K was asking. This may be a question to you, to Dr. Bridgers or Dr. Crowell. She was curious, what is her exact words? About these rapid take-home tests, she has heard that they're not as accurate. Is that true?
That's incorrect. We've done extensive analysis regarding our PCR tests and rapid tests, and rapid tests detects the virus, and we continue to use those not only in MCPS settings, but in the community setting as a whole. I'll use a personal example. I'm in quarantine now. My daughter used a PCR rapid test on Sunday and tested positive. She was in isolation, has been in isolation for the past 5 days. She will follow up with another test tomorrow. We know that the rapid test detects the virus. PCR can detect a higher level of specificity and sensitivity in the test, but absolutely incorrect. Rapid tests are effective.
Thank you, Dr. Bridgers. I think, Ms. Rubin, we'll come to you on this next one. There's a bit of anxiety here. Ebony is asking, and this is from our live questions, what is being done to address the anxieties of students attending school, while there is this surge of cases, and they certainly see some of their friends potentially coming down with COVID? What are we doing to support our students?
Sure, thank you. I think I'll begin with some of our efforts as we prepared to return to school 5 days a week, as we were exiting that online virtual learning period. We instituted a new social emotional learning curriculum out of the Office of Student and Family Support and Engagement that we intend to have go throughout all of our schools in the next year and a half. 80 of our schools are currently there. We instituted supports for our teachers, administrators, as well as our students. We continue to partner with our agency partners such as HHS and others to provide mental health supports. We've really been able to expand that, looking at expanding the cadre of mental health support services that are available throughout. We continue to support our schools on site, supporting through this process. Particular to Ebony's question about students, I think there are several things that I would just like to mention. I think from our mindfulness to our SEL curriculum to just the personal relationships that we are promoting through our Be Well 365 platform, all opportunities to address that anxiety. I think tomorrow at the board, we are looking to bring forward some creative and innovative suggestions around those families, parents, students who are feeling that anxiety, how we can further support that if there's some of the anxiety about being in school, and how we can further support students being able to still access the instructional process. Just continuing to collaborate through a variety of forums in order to address that in a meaningful way.
Thank you, Ms. Rubin. I wonder if I might go to you, Dr. McKnight, for a moment. And you've said many, many times that we're putting students first. And part of that is their social emotional health as well. I wonder if you have some thoughts in this area.
I think it's a critical area. The pandemic has had our students experience death, sickness, all of the things that impact them so many ways for the rest of their lives. And all while they were in many ways isolated from their peers and from others and from some support structures that are just naturally existing in our schools. And so we have paid close attention to this in preparation for our students returning. And this is also an area where I said the collaboration has been really important, because we have been collaborating and discussing students' social emotional well-being as well as staff. And have gotten the support in many ways, funding from council to continue to support efforts that we can put in schools on grounds to make sure that our students are feeling supported as they all come back together and figure out who are we going to be now that we're back together and we've been isolated for such a long period of time and have been impacted. And quite frankly, I feel like this is something we should have been measuring all along, even before the pandemic. We can only serve our students learning well when they are in a good place of their own well-being. And so now we have the responsibility to gauge that and to be able to support them in that way so that they can be successful in our school buildings and be available to everything that we have to offer them.
Thank you, Dr. McKnight. Kimber's asking a question next that I think a lot of our parents asked. It was frustrating last week as we dealt with difficulty related to some of our bus routes. First, maybe Ms. Nixon, and then maybe to Ms. Dawson. Ms. Nixon, can you talk about the recruitment efforts you're doing specifically related to bus drivers?
Thanks, Chris. So a lot of the recruitment for the bus drivers actually comes out of the Department of Transportation. We have the requisitions up certainly on the website. And I know that much like the approach that we take in terms of job fairs, same kinds of things happen in the operations world as well. There are job fairs, online job fairs, in-person job fairs, and we work collaboratively with Department of Transportation once they've identified the drivers to get them hired and to get them onboarded. So that's an ongoing process as it is. And I know that Dr. Dawson can also speak to some of the alternatives that they have been exploring in Department of Transportation in terms of looking into retirees, looking at possibility of doing some screening and vetting of National Guard drivers. We even were thinking about opportunities perhaps with ride-on bus drivers. So there's a variety of very creative approaches to looking at where we can find drivers. But again, those are active requisitions on the website, and we work collaboratively with the Department of Transportation to make sure that those hires come in and are certainly efficient.
Thank you very much. Dr. Dawson, I also know that there's been some heroic efforts to cover those routes in the Department of Transportation. Can you talk about that at all?
Absolutely. Actually, Dr. Nixon did explain and show the opportunities of the creative ways that we have to think about hiring. Let me just take us back a minute. When we began this school year, like other transportation in the neighboring districts, we all have been struggling with vacancies, and it is a nationwide problem. We know that, and we've been working on it. At the height of our vacancy when we began the year, it was about 140 drivers short. And we worked to reduce that through those different efforts, including, recruitment within our own ranks of our transportation supervisors interviewing and the depot managers really giving up time to do that to support HR and bringing people in. And all of the outreach that we did with our partner organizations, we were able to reduce it almost by about 30 to 40%. But as we got back after winter break, we were inundated in that first day in a matter of hours with 70 transportation drivers out. And again, we're dealing with COVID-19, and we're dealing with that level of outage and shortage. So what we have done in terms of Herculean efforts is we began to work as centralized depots in the routing priorities. And the first thing was really to cover the routes for our special education students to ensure that there aren't any more hiccups in the first 2 days. We routed transportation students to all the 4 holding schools because over the winter break, we did have 4 schools that we moved into holding centers because of our CIP and providing the new buildings and schools and additions that will be coming up in the next year and 2. We then prioritized the distances within our special programs and vocation programs, the Edison Center and different programs like that to make sure that we're getting our students to where they need to be. We have our supervisors working around the clock, really double backing, communicating the specific routes and making sure that we're really not repeating routes so that there are multiple routes sitting home for days. The important thing too is that we were able to then begin an initial list, and then by each evening at 7 p.m. we post those lists on our web, and we communicate directly with schools, and so that they can communicate with their families and get that information. And we're doing multiple measures each day on that. We're trying to be as creative as we can. The external outreach, yes, we have reached out to fire and rescue, our county partners in the different areas to see what driver or CDL options we could find. We felt like we need to be proactive, and we reached out to the National Guard to even see if we can gain some people that way. We definitely have retirees that have expressed that they do want to come back and support MCPS. And we have a hiring pipeline. We have approximately about 69 people that are waiting on different aspects of the process to get into the driver's seat. And it just isn't fast enough when you are training. So we have a full training team that is just working beyond belief to get our bus drivers behind those wheels. The numbers, the good thing is we had big numbers at the beginning, January 5th. We have seen a significant decrease Today we were down 50 routes. Tomorrow it looks like, today was 37 routes. So we've dropped significantly from where we were in the last week. But again, we have people coming back and they've been out sick, and we are grateful to have them back. But this has been a Herculean effort across the system, and we so grateful to our parents and Ride On for some of the wonderful things that they have offered. And, our students can ride for free on Ride On, and we've really worked with the high schools as well to be able to know what those routes are. And we are grateful to parents that have been supporting that and encouraging that. And we will continue to work with our partners around this.
Thank you, Dr. Dawson. I'm just watching the clock now. We're in our last 5 minutes of the program. We will finish on time because a number of our guests this evening are going to be joining a live Instagram to further discuss some of these issues with students, whoever joins us there. Quickly going through all of these questions, I think one area that we didn't quite get to enough, and I think Ms. Rubin, we'll start with you and maybe go to Dr. McKnight. There's been a great deal expected of our staff, and there's high levels of anxiety, especially because it's busy, because we're operating under pandemic conditions, and there are a number of open positions. They're covering classes. They're doing a lot of work. What are we doing to support our administrators, our teachers, even our support professionals, all of whom are doing the best they can in our schools today?
Sure. Thank you, Chris. I think that is an excellent question. From the standpoint of particularly the Office of Teaching, Learning in Schools, I can say in our Office of Curriculum and Instruction, we are supporting our schools through substitute teaching, doing bus duty, cafeteria duty, administrative support. We've extended some of our deadlines for the marking period assessments. We've eliminated others to ensure that teachers have that time and that ability. We have even pushed down the due date for the report card submission, and really working to provide that support, shoulder to shoulder guidance that around report cards and grading to allow for more flexibility with the due dates in those assignments. And across our special education area, really the same thing. Our central services staff members really covering classrooms, shoulder to shoulder with schools throughout this continuing crisis. And we understand the anxiety. We applaud exactly what the yeoman's effort that's being put forth by our school staff. And we understand that this is a time that we all really need to be side by side with each other. So we continue to apply and supply those supports and resources. And the last thing that I'll mention is thinking about how we provide that relief and what comes next in terms of how we manage our next steps as a district.
And Chris, I'll make a comment there as well.
Yes, thank you. I was on mute. You would think after an hour and a half, I'd get that right. Dr. McKnight.
That's okay. No, that's okay. It is a great question. I mentioned this earlier, and I'm sure our community sees this at this point. It takes everyone in order for a school system to operate and to function, to address all the needs of the students that we provide for them, the resources that we provide for them, the needs that they have. It takes everyone to do it. And earlier when we opened up the school year, I said, Montgomery County is a great place because we have great people here in the system, and they're here. They're here in our schools, they're in our central office, they're in our families, they're our students. And we are constantly thinking about ways to invest in them as we see the stress and the shift that they have to make every single time something changes. And we've been steadfast with that. I mean, earlier this year, we made some changes within our calendar to even acknowledge that, thinking about how do we protect the interests of the well-being of our staff and our students. And when they come to school every day or come to central office every day, starting with the question, what do you need? And starting with that question in our schools first, because that's where our students are, and answering that and getting those resources in there as quickly and as timely as possible to make a difference. And that commitment remains there. And it also allows us to continue to have that reality check of what does this look like and how are we going to continue to provide services.
That concludes our community conversation this evening. Thank you to all of our special guests. Your participation and insights for the questions we received this evening are very much appreciated. The program will be available online on the MCPS YouTube channel, on the MCPS homepage, and it will be replayed on MCPS TV on Mondays and Fridays at 6 and 10 p.m. and on Saturdays and Sundays at 9 p.m. Good night.